Assalamualaikum Miss, we are from Group 4 and we are going to present about the policy that we choose. The policy that we choose is health-wide policy. This group consists of 5 members, which is me, Nurul Frizana, and my team members Amira Hazira, Amirul Aiman, Shuhra Zafira, and Amirul Izham. This presentation gonna have 8 content, which is the first one is introduction, policy problem, objectives, strategy, strength, weaknesses, recommendation, and the last one is conclusion.
Hi, my name is Nushra Zafira binti Ahmad Sofyan Khan. Now, let's start the presentation with the introduction. What is health? According to the World Health Organization Constitution of 1948, define health as a complete physical, mental, and social well-being. In Malaysia, the health minister managed policy and services. Despite this effort, the health of Malaysians had declined over the past 20 years, such as a rise in communicable diseases. Indeed, on June 15, 2023, the Malaysian Parliament passed the Health White Paper issued by the Ministry of Health. This policy outlines strategy to improve infrastructure, increase healthcare staff, propose reform for Malaysia's health system to enhance equity, sustainability, resilience, and so on that has been occurring for almost 20 years. Next slide is about policy problem. The first is financial sustainability of the healthcare system. In Malaysia, the public healthcare system faced significant challenges stemming from chronic underfunding and limited financial resources under public control constantly. This shortfall in financial support has hindered the system's ability to invest in modern equipment, maintain infrastructure, and retain skilled healthcare professionals. For example, Malaysia's overall healthcare spending to gross domestic product ratio in 2022 at 4.7% is significantly lower than the middle-income nation average of 6.6%. Furthermore, the government struggles to sustain a free healthcare system, especially considering the increasing expenditure. Moreover, the limited option for strategic purchasing between the public and private sector contribute to the complexity within the healthcare system. The second policy problem is only focused on curative rather than preventive action. Transitioning from a society that mainly deals with sickness to one that prioritizes staying healthy requires everyone's active participation to improve Malaysia's health. Health awareness initiatives tend to target individuals in the middle and high income group, which is M40 and T20, neglecting those in the lower income B40. As an illustration, data from the National Health and Mobility Survey 2019 revealed that 1 out of every 2 Malaysian adults are overweight or obese. Additionally, 3 out of every 10 adults suffer from hypertension, while 4 out of every 10 adults have elevated cholesterol level.
Obesity is a growing health concern across the globe. Worldwide, more than 1.9 billion adults are overweight. Of this, over 650 million are obese. The body mass index that calculates the person's weight over their height is generally used to classify adults into underweight, normal weight, overweight, and obese.
The third policy problem is the increasing aging population. The healthcare system in this nation is mostly focused on short-term treatment and hospitalization. The elderly with their chronic illness and issue require long-term care, which lead to the current healthcare system being insufficient. As a result, healthcare costs for seniors are anticipated to be 2 until 3 times higher than for younger age group. Indeed, Malaysian population is expected that by 2040, those aged 65 and over will account for 40.5% of the overall population. Even Malaysians are living longer, but people are not always in better health. In addition, elderly individuals will continue to encounter various challenges such as inadequate healthcare, food insecurity, and insufficient options for housing tailored to their needs. The last policy problem is the emergence of non-communicable disease and re-emergence of communicable disease. The NCD or chronic illness were the leading causes of death in Malaysia due to a lack of awareness, late diagnosis, and insufficient response to treatment. Malaysia is no exception in terms of non-communicable disease. For example, 2019 National Health and Mobility Survey found that 38.1% of Malaysians had high cholesterol level, 80.3% have diabetes, and 30% have hypertension. However, the emergence and re-emergence of communicable disease has put additional strain on the country's public health function, outbreak response mechanism, and treatment capacity, as evidenced by the overuse of public hospital, isolation center, and primary health clinic during the peak of the COVID-19 pandemic. That's all from my part. I will pass to the next presenter.
Thank you, Zafira. Hi, I'm Frizana. I would like to present my part, which is objective and strategy. The first objective is to aim to ensure equitable and sustainable access to healthcare, accessibility and efficiency. This includes improving healthcare infrastructure, increasing healthcare workforce capacity, and reducing barriers to accessing care for underserved populations. Additionally, efforts will be made to enhance healthcare quality and outcomes through evidence-based practice and continuous quality improvement initiatives. A strategy that relates to objective is optimizing hospital care services. This strategy is one of the essential for ensuring efficient, high-quality healthcare delivery and improving patient outcomes. The second objective is the Health White Paper intends to reform the healthcare system, and one of the strategies was to encourage more collaboration between the public and private sector that will ultimately improve the delivery of services. Therefore, it is to increase access to healthcare services for underserved populations, such as rural communities and low-income individuals. This approach involves collaboration between government agencies and private organizations to improve healthcare services and infrastructure. Improving the general quality and accessibility of healthcare for everyone is the aim, and will be accomplished by utilizing the resources and knowledge of both sectors. The third objective is the Health White Paper policy, making the case for reform towards a more equitable, sustainable, and resilient health system that serves the needs of the people at all stages of life. This will involve advocating for policies that prioritize access to quality healthcare for all individuals, regardless of socioeconomic status. The strategy that relates to this objective is health promotion and disease prevention. The strategy focuses on educating individuals on healthy lifestyle choice and behavior to prevent the onset of disease. It also includes initiatives aimed at improving access to preventive healthcare services for all members of the population. That's all from me. Now, I would like to pass this presentation to the next presenter.
Assalamualaikum. I would like to continue with my point, which is the strength of Health White Paper. For the first point, beneficial infrastructure, workforce and technology. The Ministry of Health White Paper was approved by the Malaysian Parliament on June 15, 2023. In order to create a health system that is more equitable, resilient and sustainable, changes are required. The Health White Paper outlined these changes and suggests implementing them over a 15-year period in several important areas, including financing, human resources for health, prevention and promotion, and system governance. Malaysia boasts a hybrid healthcare system that combines both public and private healthcare providers. The Ministry of Health White Paper brought attention to the stark disparity in the public and private sectors, allocation of resources, infrastructure, equipment, labour and other resources, which has left public healthcare facilities and personnel badly overworked. For the second point, which is the collaboration between private and public sectors, enhance great health services. The Health White Paper, HWP, goal is to improve people's health and well-being by overhauling Malaysia's healthcare system. The COVID-19 outbreak has demonstrated the urgent necessity to restructure the country's health system to prepare it for shocks, strains and obstacles in the future. The redesigned health system ought to be a future-proof and able to survive any pandemics. Upon closer inspection, however, the document focuses more on restructuring the Ministry of Health (MOH) than it does the national health system. The concept of public-private partnerships was mentioned in the HWP, including procurement of community and hospital care. It is well known that Malaysia has a distinct dual health system, with a little collaboration until the recent pandemic happened. And with the pandemic over, both systems seem to be functioning independently of each other again. In the HWP, private healthcare is viewed as a sector that the MOH can rely on to provide additional services and resources if such a need ever arises. For instance, during the pandemic, public MOH and private partnerships should be enhanced to help to balance resource utilization across the public, private, and non-profit sectors. For the last point, which is the paradigm shift in resolving non-communicable diseases, NCDs. Since our country's independence, the healthcare system has advanced significantly, and we have made headway toward obtaining favorable results on several health metrics, as well as developing reasonable price universal health coverage. The UN Development Programme has acknowledged our experience in enhancing population health outcomes through the provision of high quality and easily accessible health services as a model that low and middle income nations might emulate. But in the past 65 years, not much has changed in the health-seeking paradigm that we have inherited for the independence era. As a manpower productivity and system to solve the situation in health sectors, Malaysia also made a shift, managing silent and moderately symptomatic patients through the use of COVID-19 assessment centers (CAC) in our government clinics and private GPs in the community, therefore preventing further strain on the already overburdened hospitals. That's all from me. Thank you.
Assalamualaikum, I am Amira and I will present the weaknesses of the policy. First one is insufficient attention on social determinants of health. The Health White Paper in Malaysia aims to foster educational health awareness and promote wellness through preventive program. However, the policy has not significantly transformed the Malaysian healthcare system, with no significant scientific studies reported. So in 2024, over 5 million Malaysia, accounting for 15.5% of the population, are dealing with chronic kidney disease. Only 5% of these individuals are aware of the disease. Azrul Muhammad Khalid, Chief Executive of the Galen Center for Health and Social Policy, emphasized the need to decrease type 2 diabetes and increase the awareness of kidney health. Additionally, Malaysia has the second highest rate of obesity in Southeast Asia, with 90.70% between 2016 and 2024. All of these rising disease rates made it clear that the Malaysian government's effort to avoid them are not fully working. Second weaknesses is absence of specific goals and benchmark. The Health White Paper has failed to achieve its second objective of ensuring equitability and sustainable access to healthcare due to the absence of specific goals and benchmark. The government's initiative, like Scheme Perubatan Madani, aims to merge a public sector aid with private sector clinics to provide essential clinical care for acute disease affecting the B40 group population. However, the Scheme Perubatan Madani (SPM) is currently lacking funding, and its implementation primarily targets only to 10 districts, and it is not effectively addressing unequal access to healthcare services, especially for rural area. Additionally, the HWP does not have a specific target district to focus on, indicating a lack of specific goals and benchmark. The declining trend of the health sector workforce, with approximately 1,000 individuals failing to report for permanent position, further make it even worse healthcare services, such as treatment and waiting period. Next is the third weaknesses is the Health White Paper policy also doesn't do much to fix the third policy problem, which is that it's hard for Malaysia's older people to get the medical care. This is because the government doesn't have enough money to protect the old in many ways, especially when it comes to healthcare. The budget in 2034 allocation for senior citizens got only 1% raised, but while look at how inflation affects the amount, the increase is really a decrease. Lack of funds could make it impossible for policies aimed at helping the elderly, like preventive healthcare programs, social welfare initiatives, and building development projects to reach their intended audience or achieve their desired result. I guess that's all from me, and I will pass to the next presenter, which is Aiman. Thank you.
Hello, my name is Aiman, and in this part, I will be talking about recommendations. I want to emphasize on the critical importance for the government to address social determinants of health in policy formulation. Social determinants of health encompassing factors like the economics, food security, education, and environment which profoundly shape our well-being. And integrating these factors into a policy is crucial to reduce health disparities and promoting overall wellness. Imagine a policy that not only treats symptoms but also tackles the root causes like inadequate housing leading to health risks. By incorporating these social determinants, we can create a more effective and equitable policies. As the government strives for a better public health outcomes, let's ensure that the government policies are inclusive and comprehensive, considering to our diverse needs in our society. Building on the importance of addressing social determinants of health, let's delve into the next crucial step, which is developing a monitoring and evaluation system. The government should create a policy that considers social determinants, as it is also imperative to ensure that these policies are effective and accountable. Implementing an MAE system allows the government to track progress, assess impact, and also make informed decisions based on the evidence. By monitoring and evaluating policies, the government can identify what works, what doesn't, and what may necessary adjustment to improve the outcome of the policy. The government should not only address social aspects, but also ensure that their efforts lead to a meaningful change through robust monitoring and evaluation. As we are focusing on the importance of developing a monitoring and evaluation system, let's now focus on another critical aspect, which is allocating specific funding. As we emphasize the need to effective policy for implementation and accountability through monitoring and evaluation, it is also essential to address the issue of equitable funding allocation. The government is urged to recognize that equitable funding allocation is crucial to ensuring inclusive health policies, specifically allocating specific funding to address the needs of vulnerable populations such as the elderly. And it is important. Considering the increasing health demand due to aging population, it is paramount for the government to allocate adequate funding to address chronic diseases and disabilities among the elderly. Let's advocate for increased funding allocation for the elderly care, drawing insight from successful examples like other countries in China and Germany. As we draw to a close, it is imperative to reflect on the assessment of the Health White Paper policy. Through careful evaluation and analysis, it is evident that this policy embodies confidence and determination in safeguarding the health or well-being of the public. Yet, it is important for us to acknowledge that in its formulation, certain compromises were made, resulting in some inherent shortcomings. With a concerted effort to address the concern of the populace and society at large, coupled with robust goal setting and adequate public funding, the potential for remarkable efficiency becomes possible. This transformative policy, long overdue in our nation, beckons for a nationwide adoption. The urgent need to reform our healthcare system and services cannot be overstated. Drawing inspiration from successful reforms in countries like Finland, Germany, and Ireland, we are reminded of the possibilities that lies ahead. In conclusion, let us embrace the promise of the HWP, recognizing its potential to reshape our healthcare landscape for a betterment of us all. That's all from us. Thank you so much.